inama imaze gufungurwa ku mugaragaro na nyakubahwa perezida wa repubulika ndetse aho nyine bagiye bagaragaza zimwe mu ngamba zitandukanye zagiye zifatwa n'uyu mugabane wa Afurika. Iyi nama rero by'umwihariko igiye kuba muri kano kanya ikaba igiye kureba ibyo ibihugu bigize umuryango w'ubumwe bwa Afurika byiyemeje ndetse no kureba aho bageze babishyira mu ngiro. Tukaba rero turi kumwe n'umunyamabanga uhoraho muri Minisiteri y'Ubuzima akaba ari Jean Pierre Nyemazi. Tubahaye ikaze.
Murakoze.
Twari turimo kuvuga kuri iyi nama igiye kurebera hamwe commitment cyangwa se ibyo buri gihugu cyiyemeje mu rwego rwo gushora imari mu bikorwa by'ubuvuzi n'ubuzima kugira ngo ubuzima burusheho kugenda neza. Kugeza umwanya twavuga yuko u Rwanda ubwacu duhagaze.
Murakoze. Nk'uko bivuze iyi nama koko igiye kurebera hamwe icyo ibihugu bya Afurika byiyemeje mu kongera umubare w'amafaranga n'ubushobozi bishyirwa mu rwego rw'ubuzima. Iyo nama yabaye mu kwa kabiri k'uyu mwaka yiyemeza ko ibihugu bya Afurika bigiye kongera imari yabyo mu rwego rw'ubuzima ndetse ariko baniyemeza ko bagomba gukorana n'abandi bafatanyabikorwa kugira ngo iyo mari ikomeze yiyongere. Icyo kandi ntabwo bwari ubwa mbere babikora kuko hashize hafi imyaka 20 habaye inama Abuja yemeje ko ibihugu bya Afurika nibura byashyira 15% by'amafaranga y'ingengo y'imari yabo mu buzima. Mu Rwanda rero twayigezeho iyo target tukaba dushyira amafaranga agera kuri 15% y'ingengo y'imari mu rwego rw'ubuzima, akaba ari amafaranga aza agakora ibikorwa bitandukanye byose biteza urwego rw'ubuzima imbere.
Twari turimo kuvuga rero muri rusange ubwo u Rwanda aho duhagaze aho tugeze dushora imari mu rwego rw'ubuzima mu rwego rw'ubuvuzi. Ibi bihugu bifite icyo byiyemeje ni nabyo bagiye kurebera hamwe muri rusange aho bageze babishyira mu bikorwa. Kuba iyi nama igiye kuba bagiye kongera gusuzuma bongere barebe se twakoze iki, nihe wenda twaba twararangaye cyangwa se nihe tutashyizemo imbaraga, baniyemeza n'ikindi bagiye gukora. Bivuze iki kuba bongera kwicara bakavuga bati twari twiyemeje iki?
Icyo bivuze ni kinini cyane kuko abayobozi bo ku rwego ruhanitse iyo babishyizemo imbaraga bigaragara ko kenshi ibi biba bariyemeje bishyirwa mu ngiro, kuko si ugushyira amafaranga gusa mu rwego rw'ubuzima, harimo no gushyiraho izindi ngamba zituma nayo mafaranga agiyemo akoreshwa neza kandi kugira ngo abaturage bose bibagereho. Ubu kuba bahuriye hano baraza kuganira kandi ku zindi ngamba zishoboka zirimo gukomeza gushaka abafatanyabikorwa, zirimo kurushaho gushyiramo private sector kugira ngo nayo izifashe, zirimo kureba niba ibikorwa by'ubuzima bigera ku bantu bose uko bikwiye, ariko banarebera hamwe kandi ingamba zatuma Afurika nk'umuryango wunze ubumwe bagendera hamwe, kuko bigaragara ko ibi biyemeje ntabwo ibihugu byose birimo biragenda kimwe. Hari ibihugu ubona bigenda gahoro bikiri inyuma, ariko iyo bahuye ari bari hamwe bamwe bigira ku bandi kandi bakongera bagafata commitments zo kugira ngo bizamuke.
Akenshi iyo birumvikana hashowe imari mu bikorwa by'ubuzima mu bikorwa by'ubuvuzi umuturage byungukiramo. Uyu munsi twavuga ngo u Rwanda mu bijyanye no gushyira imbaraga mu ishoramari mu bijyanye n'ubikorwa by'ubuvuzi, mwari muvuzeho nk'abakora abikorera, uyu munsi twavuga ngo umunyarwanda abasha kubona hafi ubuvuzi.
Yego, birashoboka cyane kuko ubushakashatsi buheruka twabonye ko umunyarwanda nibura akora iminota 49 kugira ngo agere ku kigo nderabuzima, ariko ni igihe barebye centre de santé. Ariko kubera abajyana mu buzima ari mu midugudu na health post, ubu ibikorwa by'ubuzima biragera kuri buri wese. Murakoze.
Arakoze cyane rero umunyamabanga uhoraho muri Minisiteri y'Ubuzima. Muri kano kanya rero umushyitsi mukuru hamaze kuhagera, twabareka mugakurikira noneho iyi nama muri rusange. Televiziyo Rwanda irakomeza kuhakubera.
Excellency President Paul Kagame, Excellency President Philippe Jacinto Nyusi, Excellencies, heads of international organizations, Excellencies, First Ladies, Honorable Ministers, distinguished guests, good evening and welcome. My name is Jean-Claude Mutabazi, a pharmacist, and I will be your MC for this evening session dedicated to the Africa Leadership Meeting on domestic health financing. You may need translations. On channel 1, we have English. Sur le canal 2, on a le français. And on channel 3, we have Portuguese. May I begin by inviting Rwanda's Minister of State for primary health care, Dr. Patrick Ndimubanzi, for his welcome remarks.
Your Excellency Paul Kagame, President of the Republic of Rwanda, Your Excellency Philippe Nyusi, President of the Republic of Mozambique, Excellencies, First Ladies, Head of Regional and International Organization, members of the Diplomatic Corps, Excellency Bineta Diop, African Union Commission Special Envoy on Women, Peace and Security, welcome to Kigali for this special high-level event, advancing the Africa Leadership Meeting to increase domestic investment in health. Welcome and thank you all for joining this important discussion. Africa's disease burden is highly disproportionate, especially when it comes to HIV, TB, malaria, and some non-communicable diseases such as cervical cancer. However, investments are not growing fast enough, particularly if we consider that Africa's population will double by 2050. We will need to raise health investment faster to improve health outcomes. The Africa Leadership Meeting, Investing in Health, therefore, came at a very strategic moment where enhanced action is needed to increase domestic investment in health from the public and the private sectors. The meeting fostered increased commitment by African heads of states and government and the private sector. It's also expected that this political will and commitments forge commitments from global health financing mechanisms to increase collaboration, cooperation, and co-investments in areas such as innovative financing, research and innovation, solid strategic information systems to inform policies and programs, and ultimately investment in service delivery. This cooperation and partnership is critical for building resilient health systems in our countries. We look forward to fruitful deliberation on these important topics. Excellencies, distinguished guests, I thank you for your kind attention and once again wish you a very warm welcome in Rwanda. Thank you.
Thank you, Minister. I now invite Madame Bineta Diop, African Union Special Envoy for Women, Peace and Security, to present the Africa Leadership Meeting report on behalf of the African Union Commission.
Thank you very much. Your Excellency, President Paul Kagame, President of the Republic of Rwanda, Your Excellency Philippe Nyusi, the President of the Republic of Mozambique, the First Lady, Madam Janet Kagame, the First Lady here present. Let me also recognize the head of delegation, the honorable ministers, but also Dr. Kaberuka and our sister Winnie Bianima. Honorable ladies and gentlemen, from the outset, please allow me to bring to you, President Kagame, the warm greetings from Musafaki Mohammed, the chairperson of the African Union Commission. He would have loved to be with you today, but was retained by pressing agenda that coincide with this important conference. He was here with Your Excellency last week, as you know, for the Global Gender Summit. He has delegated me to lead the AU here delegation to this important gathering and report to you. So it's my humble pleasure and honor to deliver this report to esteemed leaders from across the world who are committed to global sustainable development. allow me to start by extending our gratitude to the government of Rwanda, but to President Kagame, the champion for health financing in Africa, for bringing together various stakeholders here today for this high-level dialogue, for the crucial role of health financing in advancing Africa's socio-economic growth. President Kagame, you are not just the champion of this agenda for Africa, but also the champion of women of Africa. We just seen it last week, but also the champion of the reform of the African Union. So we appreciate your leadership in those agenda for Africa transformation. Excellency, Africa has increased significantly health expenditure, but domestically, government spending on health, as suggested by the African Scorecard on Domestic Health Financing. The Commission is pleased with the theme of this site event as it reiterates its agenda to strengthen health financing on the continent. Excellency, African head of state and government endorsed the Africa Leadership Meeting Investing in Health Declaration to increase in domestic investment in health and to reorient Africa health system and health spending to achieve health for all on the continent. The declaration called for stronger partnership and collaboration between multi-sectoral actors regionally and globally within member states. Excellency, it's time for implementation. Accordingly, the Commission is spearheading several actions. First, the establishment of regional health financing hubs to support country effort to strengthen health financing system. Second, the development of domestic health financing tracker that will enable AU member states to measure progress of resource allocation, and then the key reform toward increased domestic financing. The digitalization of the Africa Scorecard, that's the third, on domestic financing for health, and the tracker to avail data widely and monitor health financing. Fourth, the adoption of an accountability framework defining roles and responsibility of different stakeholders to enhance collaborative implementation. Fifth, the setting up of technical working groups to encourage diverse solutions from a vast pool of technical experts across both public and private sectors to make sure no health financing dimension is left uncovered. And lastly, the convening of biennial consultation with ministers of health and finance to enhance collaboration for increased domestic resources for health and improve health expenditure efficiency. We report that the African Union Commission convened the STC in July 2019 to adopt the ALM Investing in Health Declaration Implementation Roadmap. And we thank Dr. Tedros, the director of WHO, for the support provided to the African Union. The roadmap suggests policies, regulation, and system that member states need to put in place following their specific context. Further, it also organized the first ALM Technical Working Group meeting on 12 November 2019 to review various instruments to ensure that no health financing dimension is left uncovered. Excellency, the ongoing AU reforms recommend that implementation be done through the RECs and at the national level. In this perspective, the Commission and the Regional Economic Communities Partnership Forum met to domesticate the next step of the ALM declaration. So the meeting was held on 15th of November to discuss hosting the regional financing hub within REX. So there was, Excellency, follow-up of the declaration. The Commission also take this opportunity to thank all member states for their active participation and commitment during the last global replenishment cycle that took place in Lyon. In the same vein, the Commission wishes to invite different international development partners, private sector gathered here today to join the African member state to invest in the establishment of resilient and sustainable health system that provide health for all. The Commission is fully committed, Excellency, to the right to health for all, and thus strive toward its attainment as mandated by the Africa Agenda 2063. Excellency, in conclusion, the attainment of sustainable health financing in Africa is within reach. However, this required extra efforts with sustained political leadership vision. The Commission stands ready and reiterates its full commitment to health for all and improve the African citizen welfare as guided by the Agenda 2063. Thank you for your kind attention, and we wish you, Excellency, very fruitful deliberation. I thank you.
Thank you, Special Envoy. I now have the honor to invite His Excellency Philippe Jacinto Nyusi, President of the Republic of Mozambique, for his keynote address. Your Excellency, you're most welcome.
Obrigado. Excelência, Sr. Presidente Paulo Kagame, Presidente da República do Rwanda, Excelência, Senhora Primeira-Dama e as homólogas que aqui também se encontram, distintos convidados, minhas senhoras e meus senhores, para os que estiveram na sessão anterior, esta praticamente é consequência daquilo que em parte falamos lá. Mas, mais uma vez, gostaria, em primeiro lugar, de saudar a todos os presentes e em meu nome pessoal e do Governo de Moçambique, por ocasião da realização da reunião de investimento na área de saúde. Quero manifestar a minha satisfação, em particular nesta importante reunião, que vai certamente permitir uma discussão profunda e sistemática sobre os melhores mecanismos com vista a incrementar o investimento doméstico para a saúde como uma das grandes prioridades dos governos africanos. A saúde é uma prioridade que extravasa as fronteiras de cada um dos nossos países e envolve uma interação permanente numa perspectiva bilateral e multilateral, exigindo o contributo de todos para a obtenção de ganhos sustentáveis em saúde. Em Moçambique, as estratégias de saúde alicerçam-se em dois grandes pilares: a provisão de mais e melhores serviços e a implementação de uma agenda holística de reformas para minimizar de forma sustentável os desafios atuais dos serviços de saúde. À frente dos ganhos até agora conseguidos está o fato da conjugação da prevenção e controle de doenças. A estratégia de reformas adotada pelo meu governo preconiza a descentralização dos cuidados de saúde primários para a responsabilidade do poder local, porque entendemos e acreditamos ser a este nível onde devem ser tomadas as decisões e as medidas-chave para a inversão do perfil epidemiológico e a redução do peso das doenças. Importa referir que são parte integrante destas reformas o investimento em recursos humanos e a adoção de uma estratégia para reforçar o financiamento doméstico para a saúde face aos desafios atuais e vindouros. É evidente que, por ser uma nova experiência, tem exigido um esforço do governo central e local na componente assistencial, onde novas abordagens estão sendo discutidas de modo a permitir melhor dinâmica sob o ponto de vista dos resultados desejados no processo de descentralização. A implementação do programa quinquenal do governo evidencia que o nosso país está a edificar um Serviço Nacional de Saúde forte e resiliente, assente nos princípios gerais dos cuidados de saúde primários. O país tem estado a empreender esforços em todos os setores com destaque para a redução de mortalidade materna e infantil, aproximando o país aos Objetivos de Desenvolvimento Sustentável. No que concerne aos recursos humanos para a área de saúde, o país tem vindo a registrar progressos na provisão de recursos humanos na saúde qualificados. Nos últimos 10 anos, o efetivo de técnicos de saúde conheceu um crescimento correspondente a 81%. No mesmo período, o efetivo de médicos aumentou, é um número que pode ser insignificante aqui, mas é importante referir, de 796, isto é, em 2009, para 2.463 em 2018, permitindo que tenhamos médicos em todos os distritos do país e em algumas localidades, uma realidade nunca vivida no passado. O Estado moçambicano tem incrementado consideravelmente na última década o volume de recursos em saúde, tendo dedicado cerca de 11,5% do orçamento do Estado à saúde em 2019, uma cifra que temos a consciência de que é muito menor, mas que reflete a realidade econômica do país e é maior dos outros tempos. Neste momento, está em curso uma estratégia de financiamento que visa aumentar os recursos internos através de uma abordagem multissectorial para encontrar formas alternativas de financiamento para o setor, tendo em conta os recursos domésticos, incluindo das parcerias com o setor privado. O governo adotou uma iniciativa presidencial, um distrito, um hospital, que serão hospitais completos com todos os serviços essenciais, de forma a garantir que todos os distritos do nosso país tenham uma unidade sanitária de referência até ao final do quinquênio 2020-2024, encurtando desta forma a distância entre as populações e os cuidados de saúde. O governo de Moçambique está a trabalhar para aumentar o financiamento em saúde, para enfrentar os desafios das doenças transmissíveis, nomeadamente a malária, tuberculose, o HIV e SIDA, bem como as doenças não transmissíveis, sobretudo na luta contra o cancro. Caros participantes, como governo responsável pelo bem-estar e melhoria da qualidade da vida da população, continuaremos a investir fortemente na capacidade assistencial de saúde como prioridade do governo e como direito universal, conforme a nossa lei-mãe. Acreditamos que, com ações coordenadas e envolvimento de todos, poderemos dar passos significativos rumo à cobertura universal dos cuidados de saúde. A terminar, gostaria de reiterar o nosso compromisso em levar avante tudo o que nos propusemos a realizar no capítulo do desenvolvimento do capital humano, pois só com um setor de saúde forte podemos ter uma população saudável e com boa capacidade produtiva. Mais uma vez, esta é uma plataforma que vai nos ajudar a refletir mas o importante é os nossos governos, as nossas lideranças devem colocar recursos para o desenvolvimento do capital humano, é a razão dos governos. E é muito obrigado.
Obrigado, Senhor Presidente. Our next speaker is the Honorable Minister of Health of the Arab Republic of Egypt, representing His Excellency President Abdel Fattah el-Sisi, the chairperson of the African Union.
Your Excellency President Paul Kagame, President of Republic of Rwanda, Your Excellency President Philippe Nyusi, President of Republic of Mozambique, Your Excellency Madame Jeannette Kagame, First Lady of Rwanda, First Ladies of Excellencies, First Ladies of Africa, African countries, our dear brother, Dr. Tedros Adhanom, Director General of WHO, Excellencies, ladies and gentlemen. On behalf of His Excellency President Abdel Fattah el-Sisi, President of Arab Republic of Egypt, and the Chair of African Union, I am pleased to extend my sincere thanks and appreciation to the leadership, government, and people of Republic of Rwanda for hosting this important meeting and for the hospitality extended to the guest delegations. Health is an investment, not a cost, as health is the main driver of economic growth and a platform for the launch of the sustainable development that we want to achieve. Allow me to share you my country experience in the last year to improve the healthcare system. Based on importance of Egyptian government attaches to the health of its citizens as the basis of development and progress, and on our belief in the right of every citizen to have integrated healthcare in order to achieve the future that our children deserve, His Excellency launched our National Health Insurance Program to serve Egyptian citizens as well as refugees and migrants living in our country. To this end, His Excellency President Abdel Fattah el-Sisi has launched a number of free public health initiatives that have achieved remarkable success. The leading one is the 100 million healthier life campaigns aiming to eliminate Egypt from hepatitis C and early detection and treatment of non-communicable diseases, those that the Egyptian people have suffered from for decades. Egypt has achieved an unprecedented global screening rate over a short period of time, covering more than 60 million. Those found infected with the virus were referred to actual treatment. The initiative brought about hope and inspired a promising vision for the Egyptian health system. This initiative has won the appreciation and praise of international and regional organizations such as the WHO, which declared it's an unprecedented achievement in the regional and the global environment, as well as the European Union and the World Bank, who reported the need to transfer the Egyptian experience to the other countries. In view of strong commitment of His Excellency, the President of Egypt, to push forward the Health Action Program in Africa, he recommended that the African people receive the same attention as well as the Egyptian citizens. And he has announced during the African Youth Conference held in Aswan, our African youth capital, in the last March, the launch of an initiative to treat 1 million Africans from hepatitis C virus, which will be the first building block of our dream towards a virus-free Africa. Complementary to the campaign of this campaign, another initiative to support women's health is, which is named the Egyptian Women is the Health of Egypt, was launched and aimed at the early detection of breast cancer, non-communicable diseases, and reproductive health. It provides treatment and awareness of the causes, as well as training of self-examination mechanisms. The initiative targeted more than 28 million Egyptian women, where 2.5 million have been screened so far in the last 4 months. The political leadership, believing in the importance of caring of the health of children and providing a better life for future generations. Several presidential initiatives were launched, including the early detection of malnutrition diseases, obesity, anemia, and stunting, and targeted nearly 10 million students annually in all governorates of Egypt in public and private schools. Early detection of newborn hearing impairment or hearing loss, an initiative starting in the last September. Ladies and gentlemen, the combination of will of successful political leadership and the efforts of national state organizations are mainstay of success and progress of nations. Therefore, Egypt has succeeded in eliminating the waiting lists in the most critical interventions, and we reduced the waiting time from average 400 days to less than 17 days in 2 months. For more than 300,000 patients recommended for specialized surgeries is recorded time, the cost which was totally borne by the state. Egypt has also succeeded in reducing female genital mutilation to become 61% in 2014, down from 74% in 2008, and establishing the first National Committee for Elimination of Female Genital Mutilation for the first time by representing all development partners from the relevant ministries and civil societies. We have also succeeded in reducing maternal mortality rates over 25 years by 73%, bringing the number of deaths to 43 per 1,000 live births. And we now covering the vaccines for all population with 99.9% vaccination coverage. Although Egypt is one of the countries with low prevalence of HIV/AIDS, it's 0.02%. It attached unprecedented attention to the fight against AIDS in order to maintain the low prevalence rate and to provide support, care, and treatment for people living with HIV/AIDS. This affected through a comprehensive and multi-sectorial response where HIV/AIDS services were integrated with other health services, which helped the patient have access to a good, cheap, and easy package without stigma. Ladies and gentlemen, in view of our responsibility towards our brothers and sisters on our mother continent, and since it was honored to chair the African Union this year, it has not and will not spare any efforts in transferring its cumulative experience and employing its specialized institution to serve African countries. And in response to our President's initiative to treat 1 million African, from virus C, several medical convoys have been dispatched in different African countries, carrying medicines, supplies, equipment, and a specialized team to support and to establish units for the control of hepatitis virus, and to train African staff in update systems for screening, detection, and treatment. The initiative brought hope and inspired. In addition, medical teams were dispatched to work inside Egyptian clinics in some hepatitis hospitals in African countries, providing all services for free and supporting the establishment of medical departments in various disciplines. Within the framework of coordination and exchange of experience between African countries, Egypt has been honored to host the third meeting of the Specialized Technical Committee of Health, Population, and Drug Control, affiliated to the African Union Commission under the auspices of His Excellency President Abdel Fattah el-Sisi. Many achievements have been made, not least of which the commitment to accelerate the efforts to overcome the hurdles and to solve the health and social problems afflicting our continent, and the collective commitment to develop a vaccination system in Africa so as to protect our future generations from diseases that have exhausted our communities for decades. To this end, we call for the unification of African pharmaceutical strategies to create a common system that avails medications for our people at a fair and competitive price through the ratification of the AMA Treaty. Ladies and gentlemen, it's a great pleasure for us to join together today to discuss such important topics that have long been burdensome to us. Let us join hands and move together towards fulfilling our commitments to promote health, safeguard the world, and serve our people. I thank you.
Thank you, Minister. It is my privilege to invite His Excellency, President Paul Kagame, and our hosts, who also serves as the chair or the leader of the African Union for Domestic Health Financing. Ladies and gentlemen, please join me to welcome His Excellency.
Excellency, President Philippe Nyusi, President of the Republic of Mozambique, Excellencies, First Ladies, heads of delegations, Excellencies, partners of in different institutions. Once again, I'm pleased to be with you. I forgot earlier, I wanted to congratulate you, President. The President of Mozambique has had elections in his country, and the election process was very successful in his favor, and we know the courts are yet to pronounce themselves, but people have spoken, so we wanted to congratulate you, President. Again, when I was told I have to speak again, I felt like inviting people who have not spoken but who have a lot to say to take my place. But nonetheless, I'll wait until we have them on the panel and listen to them. But I'll be very brief. I want to welcome this special meeting on the African Union's initiative to increase domestic financing for health in our member states. I will wish to commend the African Union Commission for moving rapidly to implement the Assembly decision taken after the African leadership meeting in February this year. I thank Madame Diop for the Commission's detailed update on the efforts to date. Of particular note is the development of a health financing tracker to measure progress toward the domestic health financing targets. The technical support of partners has been very beneficial, including the Global Fund, Georgetown University, the Gates Foundation, and the World Bank. Thank you all. As emphasized just now, earlier at the CASA opening ceremony, partnerships are indeed essential for continued results in global health. However, it is past time for governments to allocate adequate resources in national budgets for the healthcare from which our citizens benefit so much. However, spending more money is not a silver bullet. Funds must be spent well on programs that work and are sustainable. Once again, the example of community health workers in numerous countries on our continent demonstrates a policy that is both effective and affordable. The best way to convince governments to spend more on health is to provide evidence about how to spend better. The next African Union Summit is an opportunity to further advance this agenda. We are counting on your continued commitment and expertise as we work together to fully implement the decision of the African Union Assembly on domestic health financing. On this note, I want to thank you again and looking forward to continue the discussions.
Thank you, Your Excellency. And also thank you for staying with us as we are about to hear from our panelists. The next session is a panel discussion moderated by Ambassador Mark Daibo of Georgetown University. May I now invite Ambassador Mark Daibo and our distinguished panelists on the stage.
As the speakers are beginning to be seated, is the Honorable Minister here? Yeah. Is the Honorable Minister from Djibouti here? As we're being seated, allow me to acknowledge His Excellency the President President Paul Kagame and Her Excellency the First Lady, Mrs. Kagame, and His Excellency the President of Mozambique, and all protocol observed. We couldn't be doing this session in a better place. I first met His Excellency President Kagame in 2003, long time ago. For those of you who had not been in Kigali in 2003, you wouldn't recognize the city today or the country. It's been completely transformed. But a part of his vision from the beginning when I met him was health. I'd rarely met a head of state who was so clearly focused on health and saw the link between economic growth and the transformation of the country and health, and how health and human development fit into that. So it was no surprise that as he took over the chairpersonship, and we should note that the African Union uses chairpersonship. Most people still say chairman. The African Union says chairperson, and I think we should acknowledge that. It was no surprise when he took over the chairpersonship, in addition to being busy transforming the African Union and a whole bunch of other things, he took right away to domestic finance and increasing domestic finance for health because of his commitments to health, but also because I think, Your Excellency, it was 7 or 8 years ago, you put together a vision for the country to actually achieve health sustainability, so that domestic finance would actually manage the health care of the country because it was so important for the country. And so he could be in no better place than Kigali to see the transformation of the city and the dramatic success they've had in health. Before we move on to the panel, I do also want to recognize the World Health Organization and my brother Tedros, and of course the African Union Commission, who have already spoken, because they've been key partners and leaders in this effort. His Excellency is the champion for this effort, but of course the African Union Commission is leading with partners such as the World Health Organization. So Your Excellency, as Minister of Health and Finance and Economic Planning here in Rwanda, your boss has set you up rather nicely to talk about the importance of domestic finance, but also the link to domestic finance and outcomes. So I'd like to ask you 2 questions. First of all, as Minister of Finance and Planning, in partnership with your Minister of Health, Minister Diane, who's here, how you look at results and ensuring that there are results in order to finance and increase, Rwanda being one of the few countries that's achieved the Abuja Declaration. But secondly, how do you engage, or how can ministers of finance become more engaged in this dialogue, because health ministers alone, even heads of state alone, can't drive it without ministers of finance?
Thank you, Ambassador. There is a very strong case on investing in health. To convince the Minister of Finance, you need to discuss the economics of health. There is sufficient evidence about the impact of investment in health in economic growth. Some researchers suggest that the economic returns of investment in health are about 24% in terms of contribution to economic growth, which is a significant contribution. I think that argument is very strong enough to convince ministers of finance. But also the social indicators we observe year after year in terms of improving the health of our population. Secondly, another argument is about human capital, which is the main driver of economic development. And as the African continent, we are lagging behind, as evidenced by the Human Capital Index produced by the World Bank. About the 40 bottom countries are from Africa. And we cannot achieve the Sustainable Development Goals by 2030 if we don't invest in human capital, invest in health and education. So I think this is also a second argument that we can use to convince our colleagues from the finance and health sector.
Thank you, Your Excellency. And of course, one of the pieces of the African Union Commission's work is to ensure that the ministers of finance and health come together every other year. And that's a huge achievement. I know of no other continent or no other place that is doing that. And so that will be another mechanism to ensure that health and finance come together and learn from each other and understand each other. Honorable Minister, your head of state signed on to the Africa Leaders Agreement at the summit. If you could talk a little bit about what the Africa Leader meeting and its outcomes mean for Djibouti and the importance of that political commitment for you as a minister to carry forward financing for health, we would appreciate any comments you might have from your country experience.
Merci de m'avoir donné la parole. Moi, je voudrais d'abord féliciter Son Excellence, Monsieur le Président Paul Kagame, d'avoir organisé cette réunion, cette conférence internationale sur le VIH-Sida. Pour ce qui concerne mon pays, le pays Djibouti, excusez-moi, parce qu'il y a Djibouti accorde une part importante du budget national pour le financement des systèmes de santé. Nous avons un système de santé qui est passé sur des programmes fiables et solides. Nous avons mis en place un programme appelé BNDES, Plan national de développement sanitaire, qui a pour une durée de 5 ans et qui s'articule autour de 6 thématiques. Donc, ces programmes-là ont un coût. Et l'État de Djibouti, malgré sa petite taille et son financement, accorde une importance particulière au système de santé et soutient financièrement chaque année. La part du budget national chaque année est progressive. Et nous constatons une amélioration au niveau du système sanitaire à Djibouti. Comme on parlait tout à l'heure de sida, la prévalence du VIH-Sida est passée de 2,9 en 2002 à 1,2% en 2018. Cette baisse est extrêmement importante et c'est grâce aux efforts de l'État. Et nous avons mis également en place deux systèmes de l'assurance maladie universelle qui couvrent l'ensemble de la population. Il faut savoir aussi que Djibouti est un pays qui abrite beaucoup de réfugiés et des immigrants qui ont le même traitement, qui ont qui sont pris de la même manière avec les Djiboutiens. Il y a 31 000 réfugiés et n'en parlons pas des immigrés. Donc, au niveau du système sanitaire à Djibouti, l'État soutient énormément et contribue une part importante. Je voudrais adresser un message au président Paul Kagame, un message qui est du président de la République de Djibouti, son Excellence M. Nguele, qui m'a chargé de vous transmettre ses regrets de ne pas pouvoir pu être à côté de vous et vous souhaitez de plein succès à cette conférence internationale sur le sida. Ça, c'est en parenthèse, parce que le président m'a demandé de transmettre ces messages à son Excellence Paul Kagame, président de Rwanda. Donc voilà, le système de financement à Djibouti est actuellement en bonne voie.
Thank you very much, Honorable Minister, for sharing the concrete experience as a Minister of Health and how you're following up on the commitments made by your boss and the other heads of state. Winnie, first of all, congratulations on your relatively recent appointment. It's great to have you in this role. HIV and UNAIDS in particular has for quite a while been focused on domestic finance and increasing domestic finance of course, beginning with HIV, with a shift now to universal health coverage as the priority for the countries and the Sustainable Development Goals. But perhaps you could talk a little bit about the learnings, at least early in the job, from those efforts to increase domestic finance, and how you think they could apply not only to HIV/AIDS, but beyond to universal health coverage and achieving health for all.
Thank you, Mark. I'm really honored to be here at this meeting on HIV. It's brought together the scientists, the activists, the governments, and among us are people living with HIV. To them, this question of domestic resource mobilization is a matter of life and death. For many, they must be wondering, saying, when this donor money has dried out, will we still be alive? Will our governments be able to pay for the medicines to keep us alive? So it's a matter of life and death. And so, while we thank very much the donors for the recent replenishment of the Global Fund, and we thank them for bilateral support, our countries have to think very hard about what this will cost in the long term. How we will keep, until a cure is found, our people in the recurrent budget paying for treatment. That's why the prevention agenda is critical, because if 1.1 million Africans are every year getting newly infected and adding to the list to go on treatment, this burden will just keep rising and rising, and the question of affordability comes in. So I think the first thing that we must keep in mind is that with respect to this response, we must look at prevention as a human rights issue, as an issue of protecting our people, but also as a financing issue, and think about it as if we don't prevent, we increase our costs, recurrent costs in the future. Then secondly, on domestic resource mobilization, there are some things that we must do on our own as countries. There are others that we must do as a region, as Africa, and there are others where we must do globally in order to maximize our domestic resource. Here I'm talking about, at the national level, progressive taxation. We really must move there. 75% of our revenue here in Africa is from indirect taxation, value-added tax. This has its limits. Apart from the fact that it places a higher burden of taxation on poorer people than on the very rich. But it's also limited in what it can give us, considering that the majority of our people are so poor. So we have to think about passing the burden to the top incomes. We are not taxing wealth enough. We are not, even the IMF is now saying so, that there's room to tax more at the top. We need also to rein in the resources that we don't fetch. In fact, if we're talking about tax reduction, let me share with you some data I have. 2012, if I look at 4 countries, this is a report, I can tell you the source. Kenya, Tanzania, Rwanda, and Uganda, 2012, lost 2.8 billion in tax incentives and tax holidays. This could pay more than double the health budgets of these countries. And why? Why do they give these tax holidays? It is the pressure from the companies to keep the taxes down in order to keep the business. It's called harmful tax competition. So our governments need to hold the ground in order to keep the tax rate up on companies. So that's something to do together as Africans. The third one is the global tax collaboration that must happen to stop the tax dodging offshore. That's huge. UNCTAD has estimated billions that come out of Africa untaxed through many different loopholes that I can't go in here. For that one, we must take a stand globally. There are some reforms going on in the OECD, but Africa's voice and stand there is still weak. We are not strong there. And yet, we are the biggest losers. I could give some figures, but we won't have time for that, of how much we lose. So, we need to be pushy on global corporate tax reform because we lose billions that could go to our health. We need, as Africa, to rein in harmful tax competition, to stop the big companies from pushing us low and low and offering them holidays and exemptions and keep a tax rate high. We need to tax more progressively because there's money to tax at the top and move away from indirect taxes. But mostly, how we spend. I think President Kagame was right, how we spend. How we spend is getting really problematic now in this time of entering a debt crisis. I call it a crisis because more than half of our countries are today either in debt distress or near debt distress. And we are already seeing the signs of crowding out social spending. So, how do we negotiate in this context? I would have liked Donald to be here. He knows a lot about this. If we do not, again, negotiate, have a coordinated approach, we are seeing countries like Zambia, like Kenya, like already cutting social spending and debt repayments tripling even.
No, you're absolutely, and Winnie, Donald, I think, is concluding, so he'll have a chance to make some of these points. Unfortunately, we have very short period of time because we're running late, so if you don't mind, we're going to move on to the next questions. I would just point out to everyone, no one should be surprised that Winnie's previous job was at Oxfam, because she knows a lot about these issues. I now have a very difficult job of asking questions of two people who took jobs that I hadn't done a much better job with it. So it's Deb, why don't we start with you picking up on Winnie, because PEPFAR has been doing quite a bit under your leadership to engage in domestic finance for HIV, but also more broadly. And if you could talk about a few lessons related to that, what you're seeing and what you think could be done that could make a difference.
Great, and I want to just pick up from where President Kagame and Winnie were just about spending, knowing what you're spending. And I think we've spent the last 2 years, starting with when you were still at the Global Fund, harmonizing between PEPFAR and Global Fund so we can precisely know what we're expending our resources on. And that includes human resources for health, systems, and that is going to change, I think, our ability to have really concrete discussions with ministries of finance about not only what we're spending, but also getting to the bottom of what it costs. And so 5 countries right now have launched activity-based costing, again, between the Global Fund and PEPFAR, to really understand and be able to go to ministers of finance and say, this is what we spent, but this is what it really costs. Because we know we spend more than it actually costs. Finally, I think the biggest piece in all of this is policy. And that has been the most important element over the last 2 years. Governments that move with political leadership to ensure that the policies are creating a healthcare environment that ensures access. And then through their excellent ministers of health, that policy transforms healthcare at the district and the hospital and the clinic level. And when that happens, people get access. And that is what has happened in Ethiopia, in Namibia, and in Rwanda, because it's not only the presidential political will, it's the translation of that down to their ministers and the reality of those policies. And what do I mean by that? Cameroon, as of January 1st, will have eliminated both ANC and HIV access fees, both formal and informal. This is huge because it allows poor women access for the first time. When you look in West and West Central Africa, a lot of our issues are not related to how much we're spending. It's the impact of those dollars because of the lack of these policies that allow the poor access to health care. And so policies, in my mind, are as important as domestic investments. And I thank you for also mentioning education, because if we wanted to change the rates of new infections in young women tomorrow, we'd ensure all of them were in free secondary school, as some very progressive countries have done in sub-Saharan Africa. And that should really be our call to action. A policy to prevent child marriage, a policy to ensure all women have access to secondary school, and then really understanding what things cost so we can have clear conversations with ministers of finance. Because as they said to me, we know what you're spending, and we don't need all of those expensive cars in our partners' hands. So I think that's our job as good stewards of American taxpayer dollars and of global fund dollars, to really know what we're spending and knowing the impact of those dollars that we're utilizing.
Thank you, Deb, and thank you for mentioning the key issue of education and policy. And thank you also for pointing out all the smart things that I wasn't smart enough to think of that you've implemented, including the DREAMS program. Your Excellency, I'm not going to have a chance to come back to you, I don't think, because I already see Jean-Claude looking at his watch. But I do think it's important, especially as the hubs are being created with the African Union. Rwanda has actually done progressive taxation and progressive mutual, which is pretty extraordinary. Very few countries have. I remember Her Excellency, the First Lady, told me about a decade ago that it's silly that she's paying as much as someone in a village for mutual, and so you've kind of figured that out. Others are struggling, so as people learn from each other, this is a great place to learn about that progressive taxation that Winnie was talking about. Peter, there's so many things you could talk about, and you come from a banking background and understand this as well as anyone, which is why the fund is so fortunate to have you paired up with someone like Donald Kaberuka as chair. But maybe if I could ask you about the private sector, because that was part of the commitment of the Africa Leader meeting, to engage the private sector. It's one of the planks. And I know you and I have had this conversation about somewhat the delusion and fantasy that the private sector is all of a sudden just going to be dumping billions of dollars into health as philanthropic work. But maybe you could talk a little bit about how you have engaged and see the private sector engaging in a constructive way to contribute under the leadership of the African Leader meeting and the declaration and the African Union Commission, which has excellent documents and policies on how to engage the private sector.
Great. Before I talk about the private sector, though, I just want to emphasize that I think the process that has emerged through the Africa Leadership meeting couldn't be more timely, and I commend the leadership of President Kagame here, because the reality is, and you have, with Ambassador Birks and me on stage, and Donald coming up, the biggest sources of external funding for HIV to Africa represented. But the reality is, although we are committed, and PEPFAR is committed, to continuing to support the fight against HIV, the big delta in terms of funding is not going to come from us. The big delta in terms of funding is going to come from the countries and communities themselves that are affected. And if it doesn't come, the battle will be slower. We will still ultimately win, but it'll be slower. You asked about the private sector. I think there's a negative illusion and there's a positive reality. The negative illusion is we aren't suddenly going to get companies deciding that the best thing they want to do is give lots of money to fighting diseases. They should be taxed properly, and that's absolutely part of the answer. But there's a limit to corporate philanthropy, and it's not a sustainable solution. The positive side of it, though, is that private providers, private technology, private innovation can all play an absolutely critical role in stepping up the fight against HIV and malaria and tuberculosis. I think we need to get better at thinking about how to get the best out of private healthcare provision in countries, because it exists, because it is what many people face as a reality. And rather than sort of ignore it or wish it away, I think regulating it, making sure that it works in critical ways in harmony with the public sector provided is a critical tool of policy. The thing that I want to emphasize, and building on the points about how we spend the money, is that particularly if you take an HIV lens, it's really important that the resources end up supporting those who are most marginalized, criminalized in some places, stigmatized, the key populations who are most at risk. I worry sometimes when people talk about UHC that they have the U bit in lowercase, that it's not really as truly universal as it ought to be. We should have the U bit in great big bold capitals, because we really need to start with those who are lost, who are most marginalized first. I also think we need to think quite creatively about what things are the ways of spending money that are going to have most impact, because it might not always be the latest drug or diagnostic. For example, if you think about the challenge of reducing infection rates among adolescent girls and young women, many of the interventions there have to go far broader than the sort of classic biomedical. For example, keeping girls in education. And so funding free education for adolescent girls is as much a powerful tool of helping health as it is of helping education. So I think thinking quite broadly about how the money is spent is really important, particularly as we turn the lens more and more onto prevention.
Thank you very much, Peter. And really the themes that have been picked up here are pretty extraordinary across the panel. I'm seeing Jean-Claude writing a lot, so I think we're probably going to have to move to the wrap-up comment. But the themes that have come through about human capital, education and health, how these pieces come together for universal health coverage, achieving greatest impact with the resources that are available, the importance of domestic finance, because external finance can never make up the differences, and the mechanisms to do that, including taxation, and the efforts of individual countries such as Djibouti, and importantly, how to engage ministers of finance. All of these pieces will be essential as the African Union Commission takes forward the leadership that President Kagame has shown as champion for health domestic finance. I would end, and I should have said this to begin with, congratulating Peter on the raising $14 billion for the Global Fund. Again, like Deb, showing how incompetent I was, because the highest I got to was 13. But it was important that the number of African leaders that stepped up and had in the last one, hosted by Prime Minister Trudeau, but this time even more. And President Kagame has always been there and always leading that charge. And so I think, you know, all of the issues raised, actually, as we talk about how people learn from each other, Rwanda actually is innovated on, and will be a great opportunity with the WHO, with the African Union Commission, with the World Bank, with all the other partners to learn from what has been done here. You know, this is called the country of 1,000 hills. I would say in my religious tradition, we have this concept of a beacon on a light on top of a hill to guide us. I would say Rwanda has a beacon on top of all thousands of those hills. So if we just follow some of those places, we will do very well. Thank you, Your Excellencies, for staying for this time period. And now I'm going to turn to Jean-Claude. In the interest of time, I think perhaps if it's okay with you, Jean-Claude, we will stay up here for Donald's comments so we don't waste any time departing.
Sure. Donald Kawiruka, please welcome for your concluding remarks.
Thank you, Mark. I'll be very brief. When we met in Japan and in Yokohama, and you chaired this session with this excellent panel, I don't know if Deborah was there, I did say that today, 20 years ago, if you had said universal primary education is possible, no one would have believed it. Today, it is a reality. We still have in the world about 251 million kids out of school, but these are mainly in war-affected countries. But if you took away war-affected countries, literally, most of the kids are in school today, about 60 missing. Now, there are arguments about whether they are learning outcomes, but those are improving over time. So I want to conclude by saying, from what I heard from you and our leaders, issue number one, it can be done. It can be done and is being done. That is the starting point. And the reason we have to do it quickly, I would like to say very quickly, Mark, maybe 5. And this is why I think this AU roadmap, which answers the 5 whys, why, whom, what, is excellent. I think our leaders should be commended for that. Mr. President, I think you've done well to mobilize people around this because it's possible. Number one, the investment case, the returns to health. No argument there. Number two, the impending graduation of about 35 countries from aid money. In the next 4 years, about 35 countries will graduate from IDA, ADF, Gavi, maybe the Global Fund, 45 countries, or thereabout. I have to check my numbers. So these countries will have to rely mainly on the domestic resources, bearing in mind the issues of access and equity, which have been mentioned. The third reason is what I saw with many of you in the Mano River during the Ebola crisis. The external shocks to the health system and the damage, the disaster it can cause. When you have countries who are not able to cope, they become completely reliant on the international system. In the Mano River area, if the Americans are not come, and the Cubans, and a lot of international NGOs, I think would have been facing a disaster because the system had completely broken down. So for that alone, it means our countries have to do more to prepare for these eventualities of shocks. The other area is what I call the counterfactual argument. So if the international aid declined and our countries are not able to do more, what will happen? Number one, people who are not well, who depend on these services, will have to depend on out-of-pocket expenditures. They'll have to spend money from their own savings. Our families will fall back into poverty. Children may be pulled out of school. It has happened. And therefore, the danger we run is that the progress I've made on SDG number 1 on poverty is reversed by out-of-pocket expenditures because governments are not able to meet the gap left by international donors. I think, Mr. President, you put it quite right. Raising money and spending it are two separate coins, but they are related, and I'll explain. We have evidence today in Africa mainly that probably resources not efficiently spent in the health sector could be as high as 30% in supply chains and related issues, procurement and so on. So there are savings to be made in terms of how well we spend the money. In some countries, there is even underspent on the health budget. So let us raise money. So we can agree efficiently, equitably, and all this, but let us also look at how money is spent, whether it is money from donors or money from our own people. Now, I've been challenged on issue of debt But I want to say this to you. I have addressed governors and finance ministers in Accra some time back. There's another meeting with the new head of the IMF in Dakar today. I don't share the doom and gloom that Africa will be sinking into debt once again. There are issues to be careful about, how we borrow, how we spend. But I think where the issue is that in some countries indeed, debt service is beginning to push education and health. In fact, in the case of the Sahelian countries, it both debt services and security-related expenditures, especially in the Boko Haram, Sahel-affected countries. The first budget to be squeezed have been those of health and education. And because we don't know how long the crisis in the Sahel will remain, it is important that we're ready to look for ways of compensating for this. Another point President Kagame made, which I would like to emphasize. Mr. President, I want your protection here because this is controversial. When Mao Zedong came to power in 1949, they decided that there will be universal health coverage, and they had a program they called the Barefoot Doctors. Now, the doctors are not barefoot, but the idea was we cannot provide adequate health for this large country like China unless we have an innovative scheme, like the one happening here, community health workers, basic information. You could not provide that service if you want a Denmark-type health system. So, combining things like community health services, health workers, community insurance, fairly basic, simple stuff, leveraging on technology, we can actually reduce the amount of money people think we have to mobilize. The numbers I've seen here say that the target from, I think, WHO, sorry, Tedros, was that the spending we need is $105 per person. That is what is optimal in terms of health expenditure. What the African SOA card says is $86, and many countries are spending $40. I am convinced that by combining innovation technology, by targeting these types of simple preventive mechanisms, we don't have to go to raid that much money. So it can be raised. Taxation systems can be improved upon, expenditure can be improved upon, but we have to think out of the box in terms of how we raise money, how we spend it, and on how we spend it. So let me just finish by sharing this with you, because again, it's something I saw when I was still in business. The partners here, excellent panel by the way, are also figuring out how to work together better. I've been impressed here by the way PEPFAR and the Global Fund work here in Rwanda. It is, in my view, the gold standard of how partners can work together with the government, such that you prepare a transition which is not abrupt, which is not unplanned, which is disruptive. And therefore, as our countries make efforts on this issue, I think it behoves on partners to improve on how they work with governments, among themselves, so that these transitions are actually planned and non-disruptive. But what I've heard from here today is that it can be done. And this AU roadmap, which answers why, what, when, with whom, is excellent. And I think our leaders are on to something very important. This is what I've heard from you. I want to thank you again for sharing with us your wisdom, as you did in Yokohama. I want to thank President Kagame, President Felipe Nyusi, I don't know if he has left, for what you said to us. At the end of the day, it will not happen everywhere at once. You will not ask South Sudan, Somalia, Guinea-Bissau, Myanmar to have this done. It will not be possible. It will be country by country. But as Peter was saying, this will enable us to concentrate resources on where they are needed most, in situations of fragility. But it cannot be that a country graduates to middle-income country status with a per capita income of $3,000 per person and is unable to provide health for its own people. It's incongruous. We have many countries who are getting richer, they're getting wealthier, but you don't see that wealth translating into greater health expenditures or even greater expenditures on issues under discussion here. So I want to thank you very much. I seem to have been a professional summarizer of your meeting. I'm happy to do it again if you invite me. But thank you for what you do. Thank you so much. Thank you.
Thank you, Dr. Kaberuka. These are rich discussions indeed. These are rich discussions indeed. We can go on and on, but we can't leave that way. Ambassador Daibo, you have to wrap up this discussion for every speaker to give the concluding remarks.
I thought Donald was going to do the concluding remarks. My conclusion would just be to thank the panel for their extraordinary contributions. Thank the first speakers. Yes, sir.
The thing was done in a very hurried manner, sort of. So, and I thought we could add a few more minutes if you allow each panelist to maybe take 3 minutes. Having heard from the other speaker, they may have something we could benefit from expressed by them.
Thank you, Your Excellency. Your generosity is always great, and because we're already 20 minutes over time, and the President's been here the whole time. And it's your country, so we'll do whatever you want to do. So why don't we start with Peter and come this way?
For that, but there we go. Look, I don't think there are silver bullets in financing health better. I think it requires courageous political leadership, because ultimately, financing healthcare for the poorest and most vulnerable requires a degree of redistribution of resources in society. And there are ways you can dress that up in health insurance or in tax or whatever, but it's going to involve that redistribution. So that political leadership is, I think, the first requirement. The second requirement is the disciplines and mechanisms to actually spend the money well. That's been talked about a lot here, but it's easier said than done. And part of that is about having systems of accountability throughout the system, and for having people focused not so much on intermediate inputs, how many clinics, how many labs, how many health workers, but ultimately on what difference it means to lives. How many lives have been saved, how many infections averted, what is actually the health of the people. And I think all the time we need to keep reminding ourselves that financing health is just a means to an end. What you really want is the health and well-being of the people.
Winnie?
Look, to agree very much with Dawn that it can happen, and it is happening. But we need all our countries to move step by step towards owning their response and paying for it. So a gradual approach, but very deliberate, of increasing their spending and paying for the real epidemic that they have, not the one they want to imagine they have. What am I talking about? If the epidemic is showing you that it is women and girls who are most vulnerable, put your money there. Don't put it generally on everybody. Target carefully, spend on where your epidemic is. And on the question of data, I differ a bit with Dawn. I'm less optimistic. Really, some countries are shocking us. We are seeing Zambia, for example, in the last 3 years, has dropped health spending by 30%, and debt repayments have gone up by 800%. And I could give you more figures of countries. But like you said, it's possible. If I can say about a country like Rwanda in the same region, solid economic indicators, robust growth, significant increases in tax collection, low risk of getting under debt distress, it's good management. And I'm not saying it because I'm in Rwanda. It's a fact. It's a fact. So it's possible. So countries are in difficult situation now, but we have to think about a solution for all the countries because they are moving in the same direction, many of our countries.
Thank you, Winnie. Honorable Minister.
Merci de m'avoir donné la parole. Moi, je pense que zéro VIH-Sida est possible en Afrique, mais il faut que chaque pays mobilise plus de financement, plus de ressources domestiques, mais plus d'engagement de chaque gouvernement, l'engagement politique. Mais également, il faudrait innover et surtout mettre des systèmes de santé numérique plus efficaces pour avoir des données fiables et de mieux orienter nos ressources financières à ce moment-là quand on a un programme avec des données fiables. Je pense que tout est possible, mais il faut conjuguer l'effort ensemble et trouver une stratégie commune qui va nous permettre à lutter contre ces trois maladies, le VIH-Sida, la tuberculose et le paludisme. Mais cette plateforme d'ISECA qu'on vient de voir est une opportunité. Cette plateforme est une opportunité qui peut nous permettre d'échanger ensemble les idées, mais également d'ajuster nos réponses face à l'épidémie. Donc voilà, ce sont des propositions, mais on est capable de tout si on unit notre force.
Merci beaucoup, le ministère. Excellency.
Thank you, Excellency, for this additional opportunity to summarize our session. Investing in health is obvious, and we all understand the importance of this and how it contributes to overall socioeconomic development. The heads of state have made a very important decision to increase domestic financing for health, and it is feasible. There are opportunities to raise more resources for health, but more work is needed to transform these opportunities into real sources of financing. We need to increase financing for health, but also we need to spend well. So here is about efficiency. We need to find innovative ways to spend less, but to achieve higher results. So combining these innovations, including technologies, we could continue to raise more money, but also achieve better results, higher results with available resources. And the opportunities are there. We need to work more to translate this opportunity into real source of additional financing for health. Thank you.
Thank you, Minister. Deb.
Okay, so quickly, so you can all get out of here. I think the clear implication that many have talked about is the new infections that you have today are the infections that you're going to have for the next 50 years until Mark gets us a cure. And so I want you to look at the UNAIDS report by the numbers. And it should be a real wake-up call for you, because the number one driver of mortality of women globally, not just Africa, globally, is HIV again. Greater than maternal mortality, greater than any NCD by 2 to 3 times. And this is an illustration, yet we have a roadmap of countries like Rwanda, like Ethiopia, like Namibia, who've decreased their incidence down to 1 in 1,000. So we have the roadmap to success in high-burden countries, low-burden countries. So no country can say that they don't know what to do, because other countries have done it and done it successfully. One last fact. In the last 5 years, we have more than doubled the number of people on treatment in sub-Saharan Africa in flat global fund and PEPFAR budgets. That is possible because of these efficiencies. There wasn't new money added, there wasn't domestic spending added. It was the efficiency of the cadre within the health system and the task shifting and the policies that made that possible. So not only is it possible, countries have done it. And I think we are now seeing countries that are way ahead and countries that are way behind. The problem with the countries that are way behind is they're mortgaging the future of every single country on the continent by rising number of new infections, which will bankrupt entire regions. And that will come back to the continent. So all of the excellencies need to get together and look at progress and call each other to account. Countries that have held themselves accountable have made progress. Countries that have not held themselves accountable have not made progress.
Thank you, Deb, and to the whole panel for ending with challenges, but also an optimism of what can be done, and the timeliness of the African Union Commission's leadership on domestic finance, including the efficiencies and how countries learn from each other to achieve results. I would raise one last point which has not come up, which is the importance of domestic finance to sustain external finance, because I'm sure Peter and Deb would agree that unless domestic finance increases, external finance will not be maintained. And so with the optimism that's coming out of here and with the extra time granted to us by His Excellency, thank you all very much, and please give the panel and all the speakers a round of applause.
Another round of applause to our panelists and for rich discussions we had. Excellencies, distinguished guests, thank you so much. We have come to our end. Please remain seated as our guests of honor depart. And I wish you all a very pleasant evening. Thank you.
Umusozo w'inama yari iteraniye hano kuri uyu munsi. Inama yari irimo kongera gusubiza amaso inyuma, barimo kureba aho Afrika igeze ishyira mu ngiro ibyo yiyemeje mu gushora imari mu bijyanye n'ubuzima. Nk'uko rero nyine bamaze kugaragaza nanone kongera kwiyemeza ko bikwiriye ko ibihugu bishora imari mu bijyanye n'ubuzima, kandi nanone uburyo bakiramo amafaranga cyangwa se uburyo bashakishamo amafaranga yo guteza imbere ibi bikorwa bijyanye n'ubuvuzi cyangwa se n'ubuzima muri rusange mu rwego rwo guharanira imibereho myiza y'abatuye Afrika, ngo bakanamenya uburyo bwiza bwo gukoresha aya mafaranga kugira ngo koko abashe kugirira umumaro abakenera izi serivisi z'ubuvuzi cyangwa se serivisi z'ubuzima. Nk'uko nyakubahwa Perezida wa Repubulika yabisabye avuga ati gushakisha ayo mafaranga ni kimwe, ariko nanone n'uburyo bwo kuyakoresha no kumenya ibikenewe cyane kurusha ibindi nabwo ni ikindi, kugira ngo ntituzashore iyo mari gusa ariko mu by'ukuri wenda bitagiriye umumaro abakenera izo serivisi z'ubuvuzi. Nibyo rero byari birimo kuganirirwa muri iyi nama muri kano kanya, ahasubirijwe amaso inyuma barimo kureba muri rusange aho ibihugu bya Afrika bigeze bishyira mu ngiro ibyo abakuru b'ibihugu biyemeje, ibyo ibihugu bigize Afrika yunze ubumwe byiyemeje byo gushora imari mu bijyanye n'ubuvuzi, mu bijyanye n'ubuzima, ariko nanone bareba icyakorwa kugira ngo birusheho guteza imbere ubuzima, ubuvuzi muri Afrika muri rusange. Televiziyo Rwanda izakomeza n'ubundi kugufasha gukurikira iyi nama irimo kurebera hamwe ingamba zo kurandura icyorezo cya sida muri Afrika, cyangwa se icyo twakwita ngo Africa AIDS free, cyangwa se Afrika itarangwamo ubwandu bw'agakoko gatera sida ndetse n'izindi ndwara zandurira mu mibonano mpuzabitsina. Turabashimiye, mukomeze kunogerwa n'izindi gahunda zose Televiziyo Rwanda yabateguriye. Mwari kumwe nanjye Ingabire Eje Dibibio.